Hi everyone, welcome to week 3 of your Pharmacy Career Planning 1 course. This week we are covering chapter 2. And chapter 2 is all about long-term care and long-term care pharmacy and how that works. So when we talk about long-term care can be for a lot of different reasons. Typically we think of, actually the healthcare piece of it, but personal care is also involved, as well as social services, housing, all of those types of things. Typically, a resident of long-term care is anyone who has a chronic or long-term health care problem that limits their daily activities. So although we think of long-term care as being nursing homes for the elderly, a lot of other folks fall into that category. Folks that may have been accident victims, maybe they've got traumatic brain injuries, children with birth defects, mentally disabled, physically disabled, any type of chronic illness where they can't necessarily take care of themselves. So the idea behind long-term care, what their function is that they are there to help rehabilitate the patient. So it's less expensive than having someone in a hospital setting, and it obviously, more cost effective then. There's several ways that you can get long-term care. Medicare and Medicaid obviously pay for long-term care. There are private insurance companies that cover long-term care, and then there is out-of-pocket payment for long-term care. We can have different types of long-term care settings too, depending on the severity of the patient. These are just some of them. Psychiatric hospitals are things we don't necessarily think about when we think of long-term care, but they are, as well as correctional facilities. We don't necessarily think of those either when we think of long-term care, but they are. Correctional facilities are long-term care. So they're going to kind of go through and talk to you a little bit about some of these institutional settings and what makes them similar and different from others. Then we also have a setting where we are providing long-term care in a home setting. So these are things like, home health care aides, where we come in and help with the bathing and dressing and things like that. So again, a lot of different types of things fall under this bucket that you may or may not be familiar with. Hospice can fall under this. Adult daycare, what we call respite care, which basically is for the caregiver, really, more than anything else. And then retirement communities. We don't necessarily have to have someone who is in, the typical nursing home. Maybe they're just living in a retirement community, that type of thing. And our population is ever changing, and we're getting older, and because of that, you're going to see a lot more of these types of settings. Your book breaks it down into basically 3 age groups. What we call the young old, so 65 to 74, could still be employed. They're financially independent, fairly healthy. Then we get to the middle old, which is 75 to 84. And again, as you age, your risk is greater for illness, obviously. And then the 85 and older. These are typically the folks who are alone. Maybe they don't have a significant other anymore. Maybe they have a chronic illness, things like that. Now, they are going to talk to you also in this chapter about some of those chronic illnesses. Of course, we always think of things like Alzheimer's, hypertension, cardiac issues, but these are a few others that fall into that bucket as well. Parkinson's, depression is something that goes along with a lot of these conditions. So you may have, your elderly population may have conditions, multi-diagnoses, because some of these go hand in hand. And then they're going to talk to you about some of those drug-related issues with the elderly, which I am sure most of us are aware of. It's very easy for the elderly to under or overdose or not know what they're taking, and all those kinds of things that come with being elderly and having confusion and things like that. The other thing that we don't necessarily think about is the interactions between the drugs. If they're going to many different doctors, they may not even realize that some of the drugs that they're getting from one doctor interact with some of the others. And then, of course, as we age, we have a decrease in our kidney and liver function, which is going to change how our body metabolizes these drugs. So that's going to change how they react in our body. Of course, lower body weight, all those types of things. So you're going to look at a little bit of that as well. So one of the things that's really important to understand is what is your role in that long-term care setting. So, understanding drug therapy and understanding how to, prevent inappropriate use of medications in the elderly is going to be key to working with that population. So as you go through this week's material, if you come up with any problems or questions that you have, please make sure that you reach out to me, and have a great week.